Now, sudden cardiac death is the biggest killer of athletes and sports stars. It can come completely out of the blue with no prior symptoms. Earlier this year, we saw the death of Tottenham Hotspur's under-23 coach and former England international Ugo Ehiogu, aged just 44. And in 2012, Bolton Wanderers midfielder Fabrice Muamba had to be revived after collapsing during a game. He survived. Now, St George's Hospital in London is a global leader in sports cardiology, regularly puts elite athletes through their paces under the guidance of cardiologist Professor Sanjay Sharma. I met the team and experienced for myself how they put hearts to the test. This is what you go through if you're an elite athlete being tested for any sign you might be at risk of sudden cardiac death. But no top sports stars today, just me. It's a problem outside sport too, and that's why the charity Cardiac Risk in the Young runs this lab.
12 deaths a week occur in the UK alone of sudden cardiac death that affect individuals between the ages of 14 to 35. And if you think of the impact that that has, not just on the family of such a tragic event, it's got wider impacts on the community as well.
The majority of abnormalities show up on a simple electrocardiogram or ECG, but other tests are sometimes needed.
So now we're going to subject you to an exercise treadmill test. So your heart is hooked up with electrodes in order for us to monitor the electrical activity of how your heart behaves, especially when we are subjecting it to exercise.
So you can pick up quite a lot from watching a heart be put through a bit of intense exercise.
Yeah, absolutely. And along with that, we're also monitoring the extent to which your heart works, i.e. your maximum heart rate, and also there are other things we can measure such as blood pressure as well. So it's the hemodynamic response as well as the electrical activity of the heart in exercise. We're going to just start the treadmill now, and off we go.
I've got a feeling this is going to get a lot harder.
130 already. Into stage 3.
It's now starting to feel hard. I'm just on the point where you would feel like you needed to naturally run. So I'm trying to judge whether I should break into a jog. But we've been going for nearly 10 minutes now. Still a long way to go. My heart rate reaches maximum.
170. So digging deep now. Here we go. Well done.
And a few minutes later...
Last 5 seconds. And stopping.
Thank goodness that's over. I'm given the all clear, but picking up abnormalities this way can save lives. No matter how exhausted I feel, for the vast majority of us, the experts say the benefits of exercise far outweigh the risks. Amazing work going on there in St George's Hospital in South London. Stay with us on Outside Source, still to